Welcome to Decoding Parenthood, where we unleash the secrets of parenting. Today, we have Miss Kathleen Elizabeth, also known as Miss Liz. She has a psychotherapy practice in Maryland, and she'll be talking to us about a couple of different topics, but mainly depression, anxiety, and trauma. So, welcome, Miss Liz. Can you please introduce yourself to our viewers?
Absolutely. So my name is Liz. I go by that most frequently. So I have actually been in private. I've been actually in the field now for about 23 years. I am classically trained in counseling psychology. I've had my private practice for 17 years. I have been a certified trauma therapist now for over a decade, and I have a coaching business that is also national and international. So I run both of those from home, and I have actually probably seen and dealt with almost every possible diagnosis you could imagine. So, and I work mostly with adults and couples, occasionally families, a lot of times with parents and how to deal best with children and stress, and especially post-pandemic. And so I got into this field because I lost my father when I was 10, and that unresolved grief created a lot of depression, separation anxiety, abandonment issues, and I got really depressed for a very long time. So by the time I was 15, I realized I didn't want anyone else to ever feel the way that I did, and so I wanted to help people to learn how to emotionally regulate and live the best lives.
So welcome, and we are honored to have you here. How has your practice changed since COVID? Do you see more? And I know, I mean, the world is not the same since 2020, but have you seen more cases of depression or anxiety or trauma since 2020? And do you have any data on how the numbers have evolved?
The only good thing that I've actually seen that come out of the pandemic is now the board has now started to recognize tele and video health. So you can actually have a greater reach to reach people so that they can actually see a therapist from their living room. Sometimes I'll have clients that will need to be seen in their car because the only way they can get privacy away from their kids, their partner, their work. But then they don't have to travel. They don't have to commute. They don't have to sit in a waiting room. They less exposure. And and they benefit a lot, and especially if they have any kind of anxiety leaving the home, any kind of trauma. Or if they have any kind of disabilities or incapacities, it's really helped with that. So we now have more rules and regulations around televideo health. So that's the only thing I've actually seen good to come out of COVID. But in terms of what we were seeing as part of the problems, we saw a huge upswing in divorce and child abuse. We saw a lot more of depression, anxiety. We saw a lot more of a lot more health issues. And so it's been very troubling to say the least. And it's so the statistics have actually said that at this point in the United States, that we saw a 30% increase in mental health disorders. So currently there's about 126 million Americans on antidepressants and anxiolytics, which are anti-anxiety. And then there's about 50 million people actively seeking counseling treatment. And there are only about less than 700,000 qualified mental health professionals that are licensed to treat those 50 million people. So we're in high demand, but it's one of those things that we're still working on decreasing the stigma of getting mental health and counseling. People often have a tendency to think that, oh, but I need to be sick enough, or, oh, I don't have that much of a problem, or it's when you want to see you before it becomes a major problem that becomes harder to solve. So so we want to normalize a lot of feelings and emotions and provide an emotionally corrective experience. in which we're actually providing people the ability, the tools, the techniques, not to stay in therapy, not to need us. We don't want people to become dependent. I want you to get better. I want you to go out. I want you to be able to take these tools and techniques, teach them to your children, teach it to your partner, and like in that way, we provide an emotional flexibility. And this actually helps parents, especially, to teach their kids resilience.
Right.
So we can't get rid of anxiety. We're meant to have it. We can't get rid of sadness. We're meant to have it. But teaching people how to learn how to emotionally regulate so that they're not responding from their feelings, that is incredibly powerful. And it's much more empowering to the parent and to the child.
So, those numbers that you brought up there, for us who's not into this field, it's like, wow, so many cases, right? And many times, as you said, we feel like it might be just that one day that I'm sad because you don't remember your bad days for that long. So you're like, oh, maybe it was just a bad day at work and I don't need help, right? But when it comes to children, they're different than us because many times they're not able to communicate the way the adults can, or maybe, the feelings they're not able to suppress. What are like the unusual behaviors do you see or have you noticed in children when they're going through maybe, trauma or anxiety or depression? Are they like, should parents look out for those common, things like, oh, I think I should take my child for some help?
I would say that there's a lot of different things. Is like, it's really, really important for the parent to spend time with and create a routine for the child. And there needs to be stability within the home. And I will honestly say the most important thing that any parent can ever do is to work on themselves first. They need to learn how to not only acknowledge and recognize their own emotions, but to be able to regulate them. So it's because you're providing the blueprint for the nervous system of the child. So if the parent gets frustrated, if they become impatient or they become snippy, it's like, well, let's be real. We all have bad days. We've all, lost our cool. That's okay. But to be able to acknowledge that and, to be able to validate and even universalize the feeling, you're providing the blueprint for empathy. And that's what we really want is so for example, if a child is, takes away a toy or hits another child or, because those things happen. What we really want to teach them is more of a frustration tolerance. So it's of course they want things, they're free to want whatever it is that they want. Doesn't mean they're always going to get it. And so those children that are able to, delay the gratification and to be able to tolerate frustration, and then you're actually validating their feelings. Don't suppress it. Don't deny it. Don't tell them not to feel that way or to suck it up or boys don't cry. Anything like that. We're doing such a huge disservice because the child will actually disconnect from the feelings because they want to please you and they want and they need to survive. So at that point, the more you validate, the more that they actually have the ability to acknowledge their emotions, the ability to mitigate their stress. And then you're going to be actually showing them that they can get the attention that they really want and that they are loved regardless of how they feel. And that they don't always have to react from those feelings. They can learn how to respond. And this is where we come into critical thinking and learning how to deal with those emotions. It's that they have those emotions, they're not bad. There is no bad emotion.
Right.
So, but there is also consequences. And then this is where we started moving more into emotional intelligence and relational intelligence. So in this is the socialization. So so when people to say well, what is mental health? Mental health is the overall psychological, emotional, physical well-being of a person that is sustainable and provides self-efficiency, autonomy, and then being able to live with a quality of life and be able to share that. What we found is that 80% of our overall health and well-being over a lifetime is predicated upon the quality of our relationships. And it's like, that starts with us, and it starts with our children. So when it's like, in our children, how else would you actually teach them that? You get to learn how to play nice. So a lot of times I see a lot of anxiety where they're just being shuffled off to school. They're being indoctrinated. They have to behave a certain way. They have to sit down and be quiet, and and like parents these days, they're stressed. They're stressed out. They're tired. They come home. Oh my gosh, I gotta fix dinner. There's lots of different things. But it's like, but a parent who can learn how to take care of themselves, and you have to put yourself first. And I know that, like, especially for women, that can be very challenging. So put yourself first, and it's like you're showing them healthy boundaries. And then it's like, and then the relationship that you have with your partner provides and protects for them. So there's a lot of things that go into that. So like when I see a lot of kids that come in high anxiety because they don't know how to talk, they've been taught how to use their words. They're not feeling heard and understood. One of the simplest things that I tell my parents to do, have a meal with them. We've actually, we've seen that all the research has indicated if you just simply sit down and then ask your child, how did your day go? Now I realize for a lot of my people who have teenagers, they're going to be like, teenagers,
or nothing.
Whatever.
It was good.
It was okay.
It was good.
Yeah. And it's like, don't let them stop there. So, and it's like, you get to kind of challenge. And it's like, what I see a lot of times is like, I see where the parent is trying to be their child's friend. You are not their friend. You are their parent. And the people need to be able to say no, which again is part of building the frustration tolerance. So it's like, say no.
But I think maybe they're saying, oh, I'm my child's friend because they think the child, not the young ones, but like as they grow, like a teenager might be able to share more things that happen in their life freely. I don't know if, now that you mentioned that, I don't know if, calling yourself your child's friend betters communication between the teenager and the parent, or does it keep the same?
It keeps the same. This is one of the reasons why it's so incredibly important that, so the parent has their own support system, and they should not be crossing, specific boundary lines. Like, for example, telling their child, intimate things about their partner, their father, or, about their dating life, if they're single or divorced or widowed, about the frustrations at work or finances. It's like, your child does not need to know that. Like, you get to leave them out of that, until they are old enough to be able to learn how to do that for themselves. But again, you're providing an example. So it's like, you're not their friend. You're their parent. They need that far more than anything else. So for example, teenagers. Teenagers have 3 jobs: to be pissed off, to push boundaries, and to be sexual. And they do all of those quite well. But your job is always going to be to provide the safety net. My father used to call this the circle. It's like, you get yourself in trouble. It's like, you find yourself in the circle. My job is to yank you out of it. And it's like, so this is how they learn critical thinking. This is how they make mistakes. We're actually going to be normalizing failure. What did you fail at today? Like, we're all going to fail. We don't get to be afraid of failure because we're all going to make mistakes. What did you learn is a much more important question. Now, where do you want to take that? So you're providing them more resiliency rather than pointing out what they did wrong. So a friend is not going to do that. A friend is going to look more for approval, validation. They're going to tell you what you want to hear. And I see a lot of my parents, the reason why they have such a hard time telling their child no, providing discipline, or because they equate discipline with punishment. It's not the same thing. Those are collapsed. there needs to be a line. And when there's a very healthy line, this is what provides not only the basis for their value system, for their beliefs, it provides more of a sense of, I feel safe in this. Here's where I end and here's where you begin. I can say no, and I can be okay with that, even if you're upset with me. So even if your child is upset with you, it's okay. Allow them to be upset. This is where you get to validate. So this is why my parents need to be secure in their own feelings and being able to like mitigate and regulate their own emotions. So when we do that, that is incredibly powerful. So that's how they form and create their own identity. So then when they go out into the world, they're going to be able to face those things. So it's like, that's the real pandemic. It's like long before coronavirus or CV-19 is stress is the biggest factor in what we actually see in brain development of children and of teenagers. It's like your brain is still developing until the age of 25. And what I found is that when people are disconnected from their feelings and they don't know how to think or feel, they do not feel safe in their environment, they feel like they can't talk to their parents, their peer groups, and there's a lot of social pressure, especially with social media. It's like social media is like the dopamine slot machine of the internet. And it's never a good thing. It has actually physically changed the brain of children growing up today. And so people need to be able to understand, their own boundaries, because a lot of times there's the cyberbullying is really bad.
Yeah.
It's really horrible.
Yeah.
And it's like there's somebody else on the other side of that screen. And it's like, so we need to be able to see that, and we need to be able to interact with that. And we need to be able to have a lot of those social skills, that social knowledge, which is being lost. So there's, I see a lot of that. And I really want to tell people, it's like, you can learn how to do this with you can learn how to do it with mindfulness. You can learn how to do it with meditation, breath work, because any kind of anxiety lives in the body. And it's like, so when people end up disconnecting and a child ends up growing up, I don't feel seen, I don't feel heard, I don't know who I am. That's where we get all the confusion. That's where we get the anger. And then that's really uncomfortable. We are naturally supposed to avoid pain, fear. So what do people do? They turn to distraction. They turn to addiction. And so then emotional intelligence is just like a muscle when you go to the gym. So you're working out and you're building up, and it's like, you're increasing your lung capacity. You're increasing, how you feel and like the scar tissue that creates muscles. It's like your mind is very much the same way. So we need to interact. We need to freshen up those social skills. So, and then socially, that's how we have conflict resolution. And then we create those quality of relationships. We learn how to deal with, well, unfortunately, there will always be difficult people. So, and you're going to be teaching your child how to do that in accordance to whatever it is that your family and your culture believes.
So one of the topics that you have mentioned before is separation anxiety. Now, we see separation anxiety a lot with the young children, and, when they're starting school, their parents bring them, and of course, there's going to be separation anxiety because they have not been in this environment before, they cry. How do you, or what do you recommend for those families? Like, what are the steps they should be taking and preparing their child for, for school? And it doesn't have to be, preschool, even elementary school, because they've never left home. And here you go, and you get your lunchbox, and here you go. So how do you prepare, or what are the points can you give to those families?
So much there. So I appreciate the question. So separation anxiety, one of the first things I really want to emphasize is that it is completely normal. It actually can start from 10 months and usually starts to dissipate around the age of 4 to 5. And it's so this is predicated upon attachment theory. So it's you have a secure attachment style, you have an avoidant attachment style, and then you have basically a type of anxious attachment style. And then there's kind of an anxious avoidant, which is more of a mix of the two. So, so to create more of a secure attachment style with the child, it's like being able to provide a sense of safety. What does safety mean? How do we have that? Predictability. So this is something where parents can actually have their child go to the school, go to the daycare, meet the babysitter, and or like have the environment. And it's like, so introduce them. It's like the same way it's like, the introduction of like a sibling, like let's say like a family has like, another baby on the way. You prepare them to be a big sister, to be a big brother. You prepare them like, oh, there's going to be another baby. You get to do this. And you're actually like, you're building up, but you're normalizing that. And then they get to practice. And so it's like, just like they, practice going out to the car. Or we practice like, oh, mom's going to leave for like 5 minutes. And, and then you come back and then you praise them for being calm. And, and like you reassure them that, I'm going to love you. It's like, just because you can't see me doesn't mean that I'm not here and that I'm coming back. And like build up to that. So, and building up to that means like, at some point you'd be gone for like, 45 minutes while they're with the babysitter or, and like, going to the school and like introducing them to like the facility, here's the chairs, here's a table, talk to them about what they can expect and what it is that they get to do. So it's like all of those things can be really positive. And it's like, but then you also, and this is a mistake that I see the most often is when parents will create the context and they'll introduce the situation, but they don't validate the feelings. And this is the part where a lot of parents don't do that because they don't think to, because they're like, but I'm dealing with, they're like, a lot of parents are dealing with their own insecurity or they're dealing with their own guilt. Oh my God, I'm leaving my child and I have to go to work. We need 2 incomes to be able to pay for things. And, in this day and age and inflation. And so it's like, but preparing them goes a long way, but you also want to prepare them to go, it's okay if you feel sad, mommy won't be there, but I'm going to be there at the end of the day. And it's like, it's okay if there's, you may have, some residual anxiety, some residual sadness. It's okay if like some things you're going to be introduced in the environment, other kids or other people you may not necessarily like, and that's okay. You don't get to act on those feelings. And it's like, so you're teaching, you're normalizing that. And then you're introducing not only the situation, but also the feelings. And then they get to make up their own mind. And then it's like, at the end of the day, you get to talk about that. You get to process that with them. This creates the basis of a routine. This is what creates safety. They're learning how to trust themselves and therefore learning how to trust their environment. When we don't trust the environment is because we're not trusting that we can handle what's actually being caused and created. So it's like, and they're going to be looking to you. So it's like, so a lot of the parents who end up rushing to the child or they want to rescue them or, where they end up getting teared up and like, oh my gosh, I'm a horrible parent. I have so many parents who'll say, oh my God, am I scarring them for life? No, you're really not. And the children are very plastic. They're very like resilient. But it's also that they're going to be looking to you for that nervous system response. So this is one of the things where you're going to be teaching them and teach them self-soothing techniques. So if they get sad, if they get upset, don't deny the feeling. Don't tell them like, buck up, it's okay. Don't feel that way, don't cry. Let them. Okay, I see that you're feeling sad today. Do you want to talk to mommy about it? I see you're angry, so tell dad what you're angry about. And it's like, and normalize that. And then it's like, make sure that you're in close proximity to them. Like, and especially for my kids who are more ADD, touch them. This is actually going to light up the receptors in the brain that they're actually going to learn how to calm their own nervous system. And they learn that. They learn it so fast. But we're more afraid that, are they going to need me?
Yeah.
Is this okay? Or we're afraid they're always going to feel that way or they're always going to have that meltdown. No, they won't. They learn how to do that for themselves and they're going to need those skills for the rest of their lives. So you're not damaging. And it's like, the other thing is like that a lot of times if like there's something negative like within the environment, a teacher, caretaker, another kid that's going on, it's like don't ever speak negatively, just like you would never speak negatively about your partner or in front of the children. You don't argue unfairly in front of children. You also don't speak badly about the place that they're going, because it's going to perpetuate. They pick up so many cues from you. They're little sponges, and they pick up everything. And so when you see that like they're having a negative response or reaction, explore that with them. Don't be too afraid to go, so this is, and sometimes like I have my parents who react negatively because they feel embarrassed, but they're not supposed to cry. Oh my God, everybody's looking at us. Yeah. No, if anything, every single parent's going, been there, done that. And, and then it's like you realize, no, I'm okay. You're okay. They're going to base that off of you. And like children are extremely energetic. And they're also going to see like how you respond, and they're going to mimic that. And it's like, and allow yourself to actually have your feelings too. And it's like when you make mistakes, you also get to acknowledge that you're going to be teaching them. So it normalizes that as well. So separation anxiety. So most children will actually, they grow out of separation anxiety. Only about a third of children, like it will last into their teens. And these are shy, more introverted kind of kids. And I get kids who are introverted. Like a lot of people go, oh, like we have a tendency as a society, as culture, to laud and applaud the people that, are very extroverted. They're very charismatic, and they publicly speak well. People like them. They just people sort of flock to them. But the most of our society is actually introverted. And there's a very subtle power that comes with that, and that there's these kids who are the people watchers. Don't be alarmed if your kid is like a little bit clingy, and it's like, or if they're a little shy, nothing wrong with it.
So you gave us, some amazing nuggets, and we have over the years heard so many parents talk about, their child's first day in school, and how they worked months to prepare them and create the excitement. But I think the most important nugget was the feelings. We consider feelings such a small part of our integral life, when actually it's more than everything else. Because if you don't feel confident about yourself, or if you don't feel happy about yourself, you're not going to be able to enjoy those, amazing moments that are going to happen, or things like that. I do want to, ask you about separation anxiety in adults, because as you mentioned that, kids go through separation anxiety, and we adults go through it too. Like, oh, I feel so bad leaving my baby, or like, a first-time mom is leaving her baby in the daycare and feeling so guilty about it. What can those parents do to cope up with separation anxiety? The kids, we can talk to them about the feelings, but adults, who should they talk to, or what can we do to cope up with that?
So it's really interesting is like you adults very much can have an anxious attachment style.
Yeah.
And, I see that a lot with my people who are like dating, or, like even in relationships, it's like because they become jealous, or they compare themselves to other people, and it's like, and some of that is from childhood, but it's like our attachment styles can also change across our lifespan depending on what happens. And it's like, so what people can really do is more self-awareness. This is like, knowing what your feelings are, knowing what your reactions and responses are, and then learning how to self-manage. And this is where it's like, well, I have these feelings. I am not my feelings. I am not the things that I do. I'm not the things that I provide for other people, or how other people think about me. So it's like I said, as anxiety doesn't go away. We're meant to have it. But it becomes more of a problem when we're constantly living in a state of fear that it's actually stealing from our present. We're not actually allowing ourselves to be fully present, because we're trying to predict what's happening in the future. And we want to feel better about that. Of course we want to feel good. It's like, well, who doesn't want to feel good, right? So it's like, but having that, like we refer to it more as like just, generalized anxiety among adults, or even a social phobia or social anxiety, even performance anxiety. Like all of those are very, very real. But it's like, learning how to have compassion for yourself, learning how to sit with those feelings, learn how to feel more comfortable with being uncomfortable, because that's where the growth is. It's like you're either green and growing or you're ripe and rotting. And it's like, so to be able to deal with life on life's terms, it's like there is no bad feeling. It always has something to teach you, and it always has something to do with your body. This is why we want to be able to identify, especially like this is a great exercise with kids, is that like when your kid is feeling like anxious or sad or whatever it is, you can actually ask them, because like most of the time, like 4 or 5 years, they know their colors, and they can actually go, they know like little parts of the body. Ask them, sadness, where does color is that? Like blue. Okay. And it's like, pay attention to like their body language and how they say blue. Okay. Well, where does that feel like? What does that feel like? Well, where do you feel it? I feel that in my chest. Like, what does it feel like? I feel like I have an elephant sitting on my chest. Like, get them to be descriptive. Get them to own and acknowledge that in their body, because the anxiety is actually creating an alarm. It's like we need to learn how to like turn the alarm off. We can't do that neuroceptively. We can't do that from the top down. We want to be able to process that from the top up. And it's like, so whenever you see your child, like these are some of the self-soothing activities. Whenever you see them, like, hey, Rob, you see a lot of kids, Rob. And then, or you see like, a lot of times you can, when like you touch them, it's allowing them to be in their body. You're normalizing a sensation experience. And so what you're doing is you're teaching them how to physically reset their nervous system when they feel a specific feeling. And this actually works very, very well with my adult patients. So it's like, when like I have people who are like, married or, in a relationship with somebody who's deployed. Well, it's like, how do I deal with like loneliness? How do I deal with boredom? Or, how do I feel like when I'm going to work and I messed up that job, or I didn't get that interview, whatever it is. And it's like, we have those feelings. The first thing we want to do is we have like almost like a shame. Like, I'm not supposed to feel that way. I shouldn't feel that way. I always tell people, don't should all over yourself. And it's like, it's not a supposed to. Allow. This is the permission. And the more that we can do that, and the more we can be intuitive, the more you actually release it. It's meant to be expressed and released. We're not automatons. Every single one of us has feelings. So the more that we're actually acknowledging those feelings, we can actually shift and like manipulate and like feel them. Now we understand more of our place in the world and in those relationships. Now we have the creative problem solving. Now we can actually resolve conflict.
And you know what you need to maybe make yourself feel more confident.
Absolutely. And how does confidence form? Support and acknowledgement. And it's like at that point you get integrity. And so when people always go, how do I increase my self-esteem? How do I increase my child's? I want a confident, well-adjusted child. Well, who doesn't? And it's like, of course. It's like you get to practice with them like that routine. They be their word. Okay, honey, what outfit do you want to wear today? What kind of color do you want to wear today? And then, I want to wear purple. Yes, sir, you get to wear purple. And okay, so what kind of shoes? And like, so, and then, and then they set that, and then you follow through. So you're being your word, and that's that authenticity. And it's like, and then like the feelings, and it's like, and they get to feel good because that creates the autonomy. And then the feeling that they have, you're acknowledging that. So now they're in touch with themselves. Goes a long way. And it's like, so the feelings, so like, I think that a lot of people, they want some sort of magic pill or something. A lot of this, you're going to be practicing this for the rest of your life.
It's not a one-time thing. It's a continuous learning process.
And self-love.
And that is important to know, because people nowadays, they just want a quick response. Like, okay, I tried this. I gave this chance for my child to pick an outfit. He does, it's all mismatched. It doesn't look right. But you have to keep on giving that chance. You cannot take that away, because then there's going to be no trust. So that is very, very important to continue to working on those.
Yeah, and the greatest tool that you ever have to deal with your anxiety is right under your nose. It's your breath. So this is how we breathe. And it's like, so sometimes it's like your child is having that meltdown, that temper tantrum. It even works with teenagers, even though they're a little bit more resistant if they haven't, been raised with that. He's like, stop. Breathe with me. Right? So it's like, so the more that we can actually do that, and it's like we do not have to react because we cannot control the result. Can't control the outcome.
That's correct.
But we can't even control the event. We can control our response to it. This is why I would tell them, like, a lot of my patients, like, you are response able. So which means you have an ability to respond to a stimulus that is not collapse with fault. So it's like we don't get to shame the child. We shame the behavior. We're calling out the behavior. Is that working? How do you feel? Feel very good, does it? Okay. So what can we shift and change? This is like, basically it creates like an evidence locker for the person to go, oh my gosh, you mean I can feel this way and I didn't die? No, exactly.
Yeah.
So it's like the more that we can do that, the more they feel empowered, the more they feel enabled. That's that resilience. I can handle whatever life throws at me. And I also get to have this support system and I get to be there for other people. This is putting the unity in community. We need more of that. So it's like, because with social media, they become much more isolated. And then we make people wrong. And it's like, it's not about being wrong. It's like, well, what works for you? And that's okay.
And what works for you might not work for the next person, but that's okay because you just have to keep on trying different things and pick the things that work for you.
And then also having those boundaries. It's like, that which is for you will always find you. That which is not for you, you get used to the sound of your footsteps walking away from anything that doesn't serve you. And it's like, it's not selfish to put your own needs first. That is self-preservation. And what happens is you end up teaching other people that it's safe to be around you because you are authentic. And it's like, you can also call them on different things. So, and kids need to learn that. They need to learn how to fight fair. They need to learn that compromise is when neither party gets exactly what they want. And that sometimes we get to do things that we don't always want to do. That doesn't always feel good. And that it is actually for their own betterment. And this is the whole point of discipline. So there's lots of things I can tell your viewers, like, so much. And I know we're only limited time. So.
No worries. So today was such an amazing discussion, and we came up with so many wonderful nuggets that I know that our parents or viewers are going to appreciate. All about feelings, because we focus so much on everything else that we don't look within us. So thank you, Miss Liz. We hope that you had a good informative session with us, and we hope you can come back to Decoding Parenthood. So thank you so much.
Well, thank you for having me. So for your listeners that are watching this, if they want to get a hold of me, they can look for me online. It's www.mdpsychservices.com. You can also find me on Facebook at Liz Childs, and I'm also on Instagram, which is just lizchilds.coaching. And you can also find me on LinkedIn and Psychology Today.
And we will put all of those in our description, so feel free to reach out to us, reach out to her. If you have any questions or you need any advice, and I'm sure she will be happy to help. Thank you so much.